John Berman here in for Anderson. With coronavirus deaths nearing 142,000 and cases approaching 4 million, you will hear people say there was a change in tone from Donald Trump today. It is true his mouth emitted different sounds and words, a change, but whether we see a change in policy, a change in action, that remains to be seen. Still, for this one moment at this one briefing today, the president by and large said things out loud that he rarely does.
Some areas of our country are doing very well, others are doing less well. It will probably, unfortunately, get worse before it gets better. Something I don't like saying about things, but that's the way it is. It's what we have.
In addition to that, the president also gave his fullest, least equivocal endorsement yet of steps to slow the spread.
And we're asking everybody that when you are not able to socially distance, wear a mask, get a mask. Whether you like the mask or not, they have an impact, they'll have an effect, and we need everything we can get. We're instead asking Americans to use masks, socially distance, and employ vigorous hygiene. Wash your hands every chance you get while sheltering high-risk populations. We are imploring young Americans to avoid packed bars and other crowded indoor gatherings. Be safe and be smart.
So those words and the ones before it might just as well have been spoken by Dr. Anthony Fauci, who was conspicuously not invited. And the entire briefing can be read as something else, an unspoken admission that the president has been wrong. Wrong about his hands-off, head-in-the-sand approach to a virus that has taken nearly 142,000 American lives. That said, even as he admitted that things would get worse before they get better, he had little to say about what he would do to make them better. What he did do was issue a proclamation that sounds outlandish when you consider he's called himself a wartime president, and, as we said, nearly 142,000 Americans are dead.
We are in the process of developing a strategy that's going to be very, very powerful.
In the process, it's going to be, what's the wait? We've waited for nearly 142,000 lives. He didn't really announce a plan to make testing more available so that people aren't waiting hours or days to get tested and waiting up to 2 weeks for results to come back. Commercial labs say they're overloaded at the moment, but the president announced no federal plan to allocate unused capacity at state labs, university and hospital labs, even veterinary facilities, as one expert suggested on another network today. The president spoke of fatalities being down 75% since April. They are, however, they're up sharply in the last several weeks, as the surge of new cases became a surge of hospital patients and now a surge of fatalities. He said governors told him they had adequate hospital capacity. Well, in Florida today, ICUs at 53 hospitals are now at or above their limits. And in Arkansas, the number of people hospitalized with COVID hit a new high, with about 1 in 5 of those patients on ventilators. Texas reported 131 new fatalities. So yeah, things are getting worse. And yes, we heard the president admit it. But we also heard him say things that are not true and gloss over realities he'd rather not face, even though the country must. And hanging over all of this is the question, how long until the words spoken out loud this evening, with all the caveats attached, are replaced once again by the president we have seen and heard the other 99% of this pandemic? Remember, we have been here before.
Avoid gathering in groups of more than 10 people. Avoid discretionary travel. And avoid eating and drinking at bars, restaurants, and public food courts. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation and we will defeat the virus, and we're going to have a big celebration all together.
That was March 16th. We're all in this together. We're all rallied together. Well, not even 24 hours later, the president was on Twitter and on the attack. Failing Michigan governor must work harder and must be more proactive. We are pushing her to get the job done. I stand with Michigan. That was March 17th. On that date, just 131 people had died in this country. It took almost 142,000 more dead Americans for the president to once again appear to be facing reality. More now from Chief White House correspondent Jim Acosta. So, Jim, do we know what was behind the new words spoken out loud at the press conference?
Yeah, John, I mean, I will tell you, I talked to a White House official earlier this afternoon who said, listen, there is a recognition inside the White House that there was a perception that the president was not leading on this pandemic. And of course, that is White House speak for they knew that the guy was screwing things up. And so they wanted the president to go out there, hit the reset button, look more somber, look more serious about all of this. But as you just laid out over the last several minutes, we've seen this movie before. The question is, what does he do for a sequel? And I do think when you roll through some of what the president said during this press conference when he was urging people to wear masks, he has been downplaying the importance of masks for weeks. The question becomes, how serious will Trump supporters take these sorts of things? When you see these videos of Trump supporters lashing out at public officials about not wanting to wear a mask, a lot of that, of course, goes back to the president. And when the president is talking about not congregating in crowded bars and in crowded spaces and so on, remember the president has been inviting people to go to his rallies where there are thousands and thousands of people. And oh, by the way, he's planning on holding a convention later on in August where there will be big crowds. And oh, by the way, as you and I both know, John, having covered conventions, some of those participants end up at crowded bars at the end of the night. And so I think the question moving forward is whether or not some of what the president says today actually lasts past 24 hours.
Let's hope it lasts, and let's hope people listen. Right now, it's just a hope. The thing that surprised me most, and I don't know if he misread the script, it's when he said we are developing a strategy, the White House is, and it's going to be very, very powerful. Why the wait? Like, why now? Why haven't they developed this strategy 142,000 deaths ago?
You know, I do think that begs a follow-up question, and I think the president had moments during this press conference today where, you know, as much as people are giving him points for style and so on, I think he demonstrated once again that he is just not taking this seriously enough for a lot of Americans when he says that the U.S. has done more than the rest of the world, has performed much better than the rest of the world. That's just not dealing with reality. And when he's thrown off message with questions about Ghislaine Maxwell, the accused accomplice of Jeffrey Epstein, I talked to a source close to this White House earlier this evening. You know, that is a question that the White House should prepare the president to talk about, and it's just malpractice on the part of a White House to not have a president prepared to give a better response than I wish her well. John, at this point, they don't have a plan, and they keep trying to come up with a new plan, and today was really more of a political plan, more than anything else. This was about the president trying to reassure some of these Republicans who have lost faith in his handling of this pandemic, and a lot of independents out there who, as you know, will swing this election, who just rejected his approach. This was more of a political emergency that the president was dealing with tonight, as much as it was a health emergency, John.
All right, Jim Acosta at the White House, thanks so much.